I'm going to update the audience on some changes we made at Mayo Clinic in terms of the way we test for M proteins. We had been traditional electrophoretic detection since the 1960s, and we've been working for 5 years on a mass spectrometry-based method to detect M proteins. We spent 5 years developing it, and then we launched it 2 years ago. And we've been running Mayo Clinic patients with this new method. And the talk really summarizes some of the findings and benefits that we've seen by switching from electrophoresis-based testing to mass spectrometry. Electrophoretic methods have really been the standard for testing for M proteins in myeloma for a very long time. And this method that we're talking about was rather new and unfamiliar to most of the field, as we're the first ones really to bring it live. But there have been other institutions in both Europe and the US and I believe even in Asia that have been working on mass spectrometry-based testing. We're one of the first ones to go live, but we've been reviewing the data and our findings, our clinical findings with the International Myeloma Working Group. For the last 3 years now, we've had a subcommittee. We've reviewed the data, and I think the community feels that this method is an acceptable alternative to traditional electrophoretic methods. We put some provisos in there about some of the differences. We don't say that everybody has to use these methods, but what we're saying is we see it as an acceptable alternative. But we also recognize that these newer methods based on mass spectrometry are more sensitive. So when we track patients over time with diseases, we realize that the response rates may be different just because we have a more sensitive method to detect lower levels of disease. So we put that into the paper that we see that mass spectrometry is an acceptable alternative for electrophoretic methods. But we realize that trying to compare studies when people use the traditional electrophoresis compared to the mass spectrometry, that there'll be differences based on the sensitivity. And then the other thing that's happening in the field is that a lot of people are using these therapeutic monoclonal antibodies. These are great for patients, but they cause some interferences in the lab since we're using monoclonal antibodies as the disease marker. And then when these drugs come in, they can be indistinguishable from the disease marker. And so what we've been showing is that by weighing the drug on a mass spectrometer, we can do a better job of clearing some of these interferences from drugs like daratumumab, elotuzumab, and isatuximab. And so we recognize that in the paper. And recently, we've seen some unusual findings that have probably been there all along for the patients, and that is that some of these patients have these monoclonal immunoglobulin M proteins, as we call them, that have glycosylation on their light chain. And we did a study at Mayo Clinic tracking some of these patients from our Olmsted County study that was done in the 1990s, where we had 20 years of follow-up on. And we realized that some of these patients that have glycosylation on their light chain are progressing on to plasma cell disorders at a higher rate than patients that don't have this light chain glycosylation. So that's also recognized in the paper. And then there's some hope that we'll maybe be able to use this as a serum-based method for detection of minimal residual disease. Right now, most of the minimal residual disease detection that's recognized in the field is bone marrow based. And so we're hopeful that maybe a serum-based assay will be of aid to the patients because it's just an easier sample to get, one that causes patients less distress from getting a bone marrow biopsy and is much more economically efficient.